Hello, it's Dr. Rhonda Johnson. Today is Saturday, July 17th, 2021. Today I'm going to be talking about back to school and COVID vaccine plans. Well, I went shopping today at a couple of the area big retailers, and everywhere I looked today, there was promotional marketing for back to school, and it is that time of the year. It was exciting to see the parents shopping for the college students' dorm supplies and the K through 12 parents with their list shopping for back to school supplies, because I remember those days. But one thing is different now, and that's called COVID and the Delta variant. And one thing that most communities can count on, unless you're living in places like New Hampshire or Vermont, where over 95% of adults are vaccinated, you can count on the Delta variant will be with your students' return back to school. It may be riding on the school bus or in the cafeteria at lunchtime, could be in the library, in the classroom, in the locker room, or even out on the field. But wherever poorly ventilated spaces are, you can count on the Delta variant being present at some point during the school year. And for the parents of college students, the Delta variant will be hanging out wherever your college student frequents, be it the parties or the social or even educational events. It could be in the dorm life. So parents, it is time to make your move. If you have a student who is 12 and up, you have to make a decision soon, because that back to school clock is ticking. Just look at the calendar. How many days before the kids start back to school? And you know the students will need 2 doses of the Pfizer vaccine, separated by 14 days apart, by 21 days apart, plus 14 days after the second dose to be fully protected against COVID, and particularly the Delta variant. You know, the CDC has issued guidance, and I know that most schools, colleges, and universities are going to do everything they can to have safe environments. For the publicly funded schools and universities, they will not be able to require COVID vaccination for students or staff. But many of the private colleges and universities will require vaccination and proof for students who are going to be living on campus. So parents of college students, you should already be receiving that information, and you need to make your decisions if your students are returning to class on campus. Now, I get this. Many parents feel caught in the middle. Some parents struggled last year trying to make it with in-home learning, and many students did too. And then, to make matters worse, just as school's about to start, we're seeing the resurgence of this COVID, largely because of the Delta variant and the Delta Plus variants. And we see that children are continuing to get infected. As of July 8th, over 4 million children have tested positive for COVID since the beginning of the pandemic. And just last week, according to the American Academy of Pediatrics website, over almost 20,000, it was 19,500 children and teens tested positive for COVID. Now, there are 73 million children under the age of 18 in the United States. And as of July 8th, 8.8 million of these children here in the United States under the age of 18 have received at least 1 dose of the COVID-19 vaccine. And I think that's good news. So, you know what? I am constantly getting conversations with young people, especially men in their 20s to 40s, who feel socially pressured to not get the COVID vaccine. It may be a macho thing or belief that they're healthy and young, and certainly I know there's a lot of misinformation going around through multiple sources. You can't just blame social media. And what I tell them is that your vaccination decision is personal and it's private, because it's a health decision. You don't have to tell anybody and you don't have to feel peer pressure to not get vaccinated, just like any other medical or health and safety decision that you make. So, folks, I suggest we just keep the conversations going with our family members, our friends, the young people in our lives, and tell them that they have a right to live without COVID infection and COVID-related disability. You know, it's not just a case of getting COVID or getting the vaccine. This virus can leave for young men, and I always remind them that getting the virus, COVID infection, can leave them with a low sperm count, long-term erectile dysfunction. For young women, it can cause you to have premature birth in pregnancy. And for both sexes, men and women, can cause all kinds of problems. Chronic lung disease, heart disease, early brain fog, chronic fatigue. People with long COVID, they're tired of being sick. And kids and young people can get long COVID complications also. So in closing, it's your move, parents. Time is not on your side now because the back to school clock is ticking and the Delta variants are on the move and more variants will be coming. You know, back to school time is a time when you think of everything you need to have your kids be successful in school. And I think the COVID vaccine should be at the top of your list for young people 12 and up in terms of helping to try to ensure their success. So please talk to your child's pediatrician or your healthcare provider for any questions that you may have. As always, my views are my own. Stay safe and have a blessed day.